I give the call to the member for Kingsford Smith.
Thank you, Deputy Speaker. Most Australians believe that tuberculosis has been eradicated, but tuberculosis is a global killer. In just 1 year, 1.6 million people die from tuberculosis worldwide. Over 60% of the world's TB cases are unfortunately in our backyard in the Asia-Pacific region, where drug-resistant TB is now in a public health crisis in neighbouring countries such as Papua New Guinea and Indonesia. We don't often see TB in the headlines, but the devastation that it causes dwarfs all other forms of infectious disease. And yet almost all cases of TB today are both preventable and treatable. The scourge of TB is often a close companion of inequality. A lack of nutrition, poor sanitation and unsafe working environments all contribute to the stark reality of tuberculosis in 2019. And across the world, the poorest households and most marginalised individuals bear the biggest burden and are likely at most risk of contracting tuberculosis. Indigenous people suffer from TB at a rate up to 270 times that of non-Indigenous populations. That's an outrageous statistic. 270 times more likely to get tuberculosis if you're a member of an Indigenous population. Migrants, the homeless, prisoners and people living with HIV are also especially vulnerable to TB. And when the poor and vulnerable try to access healthcare to treat their TB, it's no surprise that they actually become poorer as a result of the financial strain, and the medical poverty trap can be seen across those individuals and groups particularly vulnerable to TB. Studies have shown that the increasing financial pressure associated with TB treatment meant that the patient in the household was more likely to abandon treatment or to have the treatment failed or unfortunately pass away. The pairing of poverty and TB also leads to a lack of access to adequate health services, including fast diagnosis and effective medicines. TB is a disease, Deputy Speaker, that's always suffered from neglect and a lack of urgency, and yet it's the world's longest running global health emergency, having been responsible for 50 million deaths since it was declared an emergency in 1993 by the World Health Organization. And it's remarkable that there's not a bigger and a much greater concerted effort to try and eradicate tuberculosis and find a vaccine that is workable throughout the world. And this is reflected in the chronic underinvestment in TB care and control in most high-burden countries. There's a funding gap of $1.3 billion annually in TB research and development, and we are still a long way off finding a workable vaccine for this insidious disease. Australia is providing funding jointly with the World Bank to support testing and treatment in Papua New Guinea, and we're also leading an initiative to achieve universal testing for TB in Daru. As the Parliamentary Secretary for the Pacific Islands in the Gillard Government, Deputy Speaker, I was fortunate to open the Australian DFAT-funded TB clinic in Daru in the Western Province of Papua New Guinea. And it's heartbreaking. It was heartbreaking to see the cases of what is a preventable disease from poor people, usually living in communities up the Fly River in the Western Province, having to come there for treatment, and the enormous impact that it had on their families and the communities. And Daru is less than 200 kilometres from Cape York, but almost a world away in terms of the impact that TB is having on the lives of communities in that area. Australia is also providing $75 million over 5 years for product development partnerships in the Indo-Pacific Health Security Initiative. This is helping to accelerate access to new therapies and diagnostics for drug-resistant TB and malaria. Medicines are needed, and that's what's the crucial aspect of this fight against tuberculosis. We're moving to a new era of TB treatment where community-based care is playing a more important role, and treatments have saved the lives of over 50 million people around the world from 2000 to 2016. And the treatment regime is becoming much better in terms of the number of tablets that a person needs to take in a day. We do need to take additional action to monitor this progress and make sure that the world takes much more appropriate and stronger action to combat TB and hopefully find a cure.